You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. Today I'd like to talk a little bit about a plant treatment for high blood sugar. And what I'd like to talk about specifically is berberine. I've been impressed by some of the properties of berberine for a long time. Berberine is a chemical present in a variety of plants, including our own Oregon grape. I originally learned about berberine's properties as a natural antibiotic against a variety of infectious organisms. But then I became surprised to learn how effective it is in managing and lowering blood sugar that is out of control. There was a study published in Metabolism, one of the journals, showing newly diagnosed diabetic patients who were assigned to receive either berberine or metformin. Metformin is the commonly used drug for diabetes. After 3 months, the fasting blood sugar had dropped from using the berberine of 191, which was very, very high, to 124, almost in the normal range. Hemoglobin A1C, which gives us an idea what is going on for a 3-month period of time with blood sugar. For those who are not aware of this simple test, it is looking for how much sugar is attached to your red blood cells. Red blood cells live for 3 months, so you can check every 3 months to see what it has been going on with your blood sugar over that period of time. A very, very important and easy test to do. This particular study showed hemoglobin A1C it should be less than 5.8 to be normal. So in this particular study with diabetics, their hemoglobin A1C on an average was 9.5%. After 3 months of using the berberine, it dropped to 7.5%, quite a drop actually. The results between the two substances were identical, meaning berberine and metformin. So they were both giving a good drop in blood sugar, but the group with berberine also showed an improvement in their lipids, meaning their cholesterol. Cholesterol and triglycerides decreased to a more favorable level in the berberine group in comparison to the metformin group. So that's kind of a nice extra bonus. Another study was also published in Metabolism, and this one it was a small study. It only involved 48 patients, but they were diabetic type 2 under poor control. Some were already using metformin, diet, or insulin. Berberine was added to whatever they were doing. And after 7 days, the average fasting blood sugar, which was 172, decreased to 140. That's pretty quick and pretty positive results. The average postprandial blood sugar, which means blood sugar after they eat something, decreased from 266 to 210. As the study continued, hemoglobin A1C dropped from 8.1% to 7.3%, and fasting insulin decreased 28% total cholesterol and LDL, which is the one that causes plaque, were significantly reduced. Berberine also, in addition to being good for your blood sugar and good for your cholesterol, is good for your kidneys. Kidneys can be damaged by having diabetes, and because berberine seems to open up blood vessels, which increases perfusion to organs, decreases blood pressure, increases oxygenation. It helps prevent any damage, and it also helps with weight loss. I use this, by the way, in my practice for weight loss all the time. This plant chemical does have some side effects if it's added to other anti-diabetic drugs. It can contribute to constipation or diarrhea and abdominal pain. The side effects are rarely seen by using berberine alone, and the side effects can be resolved on decreasing the dose. So this is really important to know. If you're diabetic, you're already on medication, you say, hey, I want to add something to get a little more support here. Be a little careful, and it would help maybe to get a consult with someone who uses this therapeutically. This substance is often used, berberine, is often used for insulin insensitivity or metabolic syndrome. If you have a fasting blood sugar that's been increasing to close to 100 or more, or have a family history of diabetes, or a history of reactive hypoglycemia symptoms, you can be benefited by using berberine. It would also be very helpful for women who have polycystic ovarian syndrome. So, anyways, go out there and be grateful we have Oregon grape and we have berberine, and explore the wondrous things that some of the plants can provide for us. Thanks for listening, and stay tuned for more exciting podcasts.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.